Module 2 emphasizes the key principles you should know when working with us, along with the expected workplace and behaviors. We will also cover a detailed overview of your daily job workflow, including patient care management, types of clinical treatments, and inventory storage. Here are some key principles to follow at work. Show gratitude and celebrate wins. Communicate clearly and honestly. Be trustworthy and reliable. Respect time, money, and resources. Maintain good manners and attitude. Keep learning and be responsible and professional. Please take note here. Pause the video if you must, because we will cover important workplace behaviors that you will be evaluated during your work. First impressions matter, not only to us, but also to patients who walk in the door. So always look professional. Keep your hair neat and wear simple, appropriate makeup. Follow safety rules by wearing gloves, mask, and gown when treating patients. Your safety and theirs come first. Dress properly. Your dress code is: be polite to everyone. Greet your co-workers and doctors warmly to create a positive work environment. Manage your time well and be ready ahead of time. Prioritize tasks to keep everything running smoothly and efficiently. Be sure patient treatments are set up at least 5 minutes in advance, unless there's a back-to-back patient flow. Stay updated on upcoming appointments, reminders, and any scheduled campaigns or events. Keep the clinic clean and organized. Keep your area neat and manage supplies. Regularly clean your workplace and check supplies according to the schedule. Communicate clearly with patients. Use language they understand to make them feel comfortable. Work as a team. Manage a professional work environment. Be friendly and respectful. Always speak kindly to patients and your colleagues. Focus during treatments. Give your full attention to patients and avoid using your phone while working. Be on time after breaks. Return at least 5 minutes early to prepare for the next patient. Take turns for your breaks. Share break times with your colleagues to ensure enough staff working. If you're not sure about this, do ask your trainer how their break time works. Prepare the room and ensure the doctor is ready before calling in patients. You'll soon receive a patient guide booklet for detailed treatment and prep instructions. Also, clean thoroughly after each patient to keep the room ready for the next one. Show care and compassion. Ensure every patient feels valued and comfortable. Lastly, always keep learning, as the first few months determine your confirmation of work. Here's a daily workflow overview to help you understand and what to expect while working here. We'll also explain the clinic's opening and closing procedures. During opening, you should on the lights, clock in, check clinic's phone and WhatsApp messages to reply them, or call back missed calls. Turn on the compressor. First, you close the tape. Turn on suction and dental chair. Insert burr to the handpieces. Do not run the handpiece without a burr. Make sure to clean the oil on the handpiece handle. Run the handpiece to ensure the handpiece is working properly. So this is how we on the dental chair. First on the switch. Secondly on the button. It's on. And you hear a sound. That means it's on. Then on the suction. On the switch. On the button. And close the cabinet. This is where we keep all our handpiece. This is also different for every outlet. Every outlet may place it at a different place. During opening, when you put back the handpiece, do remember to wipe the handpiece so that to make sure there's no oil at the handpiece. So you can take some spirit and a gauze, just spraying, and then wipe them. Wipe them thoroughly. Attach the handpiece. Down. Just click in and turn. Same goes for this one. Just click, turn. Please do note that for every different outlet, the handpiece may be different. So if you have any questions, you may ask your trainer. How? Turn on X-ray. When the doctors tell us to take an X-ray, we should always register patient ahead before asking patient to come into the X-ray room. So this is how we register patient into the system. To log into the doctor partner first, you can log into your own account easily. And pick the doctor that are on duty today, so they can see all their appointments. Then you have to open the app for the X-ray. Please take note here. Pause the video if you must. For new patient, you have to click this and enter their name. Let's say Mr. Eddie would like to take an X-ray and he's new to the X-ray system. You right-click and go to View Patient Card so that you can see his name. You can copy his name and you go back to the system, paste his name. For the chart number, we're supposed to put in his IC number. So you go back to the doctor's partner and you right-click and you copy. And then put his gender, male, and put date of birth for the patient. You can come back and see the date of birth here. For this one is 1981. And then you add patient. Once you have successfully registered for you to take an X-ray, you go to accusation and you pick the type of X-ray that you would like to take. For example, today, doctor asked to take an OPG. For OPG, it will be for panorama. For the usual X-ray are OPG and cephalo. This is a lateral X-ray. So for example, today we would like to take a panorama, which is also OPG. For the X-ray machine to get ready for scan, you have to press the confirm button and wait until 100%. Like this. After the machine has stopped moving, this means that the machine is ready for capturing X-ray image. And now you may call the patient into the X-ray room to take an X-ray. Miss Jocelyn, please come, let's take an X-ray. So I'll need you to put this lab apron on, yeah? So I'll help you wear. Please always remember to help patient to wear on the lab apron. Okay, miss, please stand here and facing towards me. Please take off your glasses also and you may put it here. Please ask patient to remove all metal accessories like glasses, earrings, necklace. For girls, some of them may have hairpins on their head. Once they remove, you may ask them to place them on this plate. Now, adjust the machine according to patient height. And now ask patient to put their chin here and bite at the dent area of this stick. Yes. And make sure that the red line is at the ears and the cheekbone. It's aligned with the ear hole and the cheekbone. And that this middle line is aligned with the midline of the incisors teeth. And that this line is aligned with the canine. Once patient is in the correct position, you may lock her head so that she will not move during the procedure. Now, and also make sure patient position is at a natural standing position, not leaning forward or backwards. Now, once everything, may ask patient to hold her hands here and ask patient to close her eyes. Do not open your eyes after the procedure is done. So once everything is ready, please click the ready button and wait for a blue window to appear. Now look here, once the green light has appeared, press the button and do not let go. We must release only until the yellow light is off. Once the yellow light is off, you may release the button. Now, loosen her head and ask patient to stack backwards. And remove the lead apron for patient. And ask patient to have a seat so that doctor can explain the procedure. And remember to remind patient to wear back all her accessories if she has taken off any. Take out autoclave items and place back instruments. So this is the autoclave machine. Every morning you have to take out the sterilized items inside. So you press this button and then you open. And then you can use this to take out the tray because it's very hot. So be careful. And then just cut them. And then you put the items back to its original place. Clean the distilled water machine and boil distilled water. So during opening, you can check whether the distilled machine is dirty or not. First, boil water. So you wait for it until it's boiled. Pour inside. And take lime powder, which looks like this. So put 2 spoons. The switch and on this button. Then wait for it to boil again. Okay, now that it's boiled, off the switch and take off the plug. Okay. So wipe until it's clean. Make sure not to use the rough surface for this. Only use the smooth surface. Now just wash off the soap. Careful not to pour water at the electrical connection area. Water the plants. This depends on the outlet. Make sure the gauze, cotton pellets are always more than enough. Make sure all the gauze, this is not enough, this is empty, so you have to refill all the gauze and the cotton pellets. Set up the dental chair. You should do this during the closing too. During closing, clean the suction and handpiece. So, you take off the tip, put it aside, and you take the solution. So there's a line in there, indicator. We put 2 cups. Add water, tap water until the 2 liter. So put on the cap. And then you put, and then you wait for it to suction until 1 liter. Yes, so once it reaches 1 liter, you can stop the suction. Just put it back. Yes. Then the remaining 1 liter, you put it here. Then just put it back. You put the tip back. Remove burr and handpiece from the dental chair. We must take off the handpiece and put it back. Add lubricating oil to the handpiece. And remember to add lubricating oil into here. This is the lubricating oil and then spray. A little bit will do. Then put it back. You may put it upside down so that the oil wouldn't leak out. Set up the chair, refill things like cotton roll, gauze, microbrush, etc.
When setting up the dental chair, ensure that the necessary items are checked and restocked. Cotton roll, cotton palate, gauze, microbrush, composite etchant, bonding composite, composites, flowable composite, compactable composite, articulating paper, cellulose strip, distilled water, tissue, cup, bib, blue barrier tape, blue barrier tape, blue barrier tape, blue barrier tape, scalar tip and polishing brush, suction tip and high vac, plastic sheet for dental chair working table.
Sweep and mop the floor. Off the compressor. Off the autoclave. Close the water pipe. Close and mark down the electric meter if there's any. For the closing counter, write and send sales report via WhatsApp. Print the settlement. Send tomorrow's appointment. Make sure all the doors are always closed. Make sure all lights are off unless told so. Throw the rubbish to a proper place. PGB or Patient Guide Booklet. A patient guidebook is designed to visually outline our treatments and pricing, enhancing patient experience. It also supports new dental assistants like you by providing important information to effectively address patient inquiries, even with limited initial dental knowledge. Structure of the book covers basic inquiries, aesthetic dental treatments, restoration and replacement treatments, and other dental treatments for children. Basic inquiries includes scaling, extraction, consultation, x-ray, and retainers. Aesthetic treatments includes whitening, veneers, braces, and the types of braces that we provide. Surprisingly, we also provide Botox and filler. Restoration and replacement treatments includes implant, bridges, denture, filling, dental crown, root canal treatment. Early correction dental treatments for children includes scaling, extraction, consultation, pulpotomy, crown, early orthodontics, habit correction, and tongue tie.